Bismillahirrahmanirrahim. Assalamualaikum and very good afternoon. So here we come back for the next presenter in our final presentation for post-basic pharmaceutical sterile in all subject. So today our live is via StreamYard and also can be watched in YouTube with others viewers. So without any ado, we go to our panel for today, Mr. Sazwan Aizat. Assalamualaikum Tuan.
Waalaikumsalam warahmatullahi wabarakatuh.
Right, thank you. How are you Tuan?
I'm fine, little bit thirsty. So many comment over here.
Never mind Tuan. Alright, next we go to our presenter for today is Puan Rubashini
Yes.
Alright.
Yep.
How are you Puan?
Okay, I'm fine.
Alright, thank you. So without any delay, the floor is yours, Puan. Thank you.
Okay. Thank you, Jaiza. Thank you, Mas Dila. Okay, today I'm going to present my first activity. Okay, it's about handling of hazardous agent in the category of radioactive. Okay, what is radioactive? Radioactive contains a substance that produces energy in the form of powerful and harmful rays. A radionuclide, also called as radioactive nuclide, radioisotope or radioactive isotope, is an atom that has excess nuclear energy, that making it unstable. Okay, an imaging tracer made with radionuclides is called a radioactive tracer. A pharmaceutical drug made with the radionuclides, it's called a radiopharmaceutical. And in nuclear medicine, radioisotopes are used for diagnosis, treatment, and also for research. Okay, radionuclides that find their way into the environment may cause harmful effect as a radioactive contaminations. Potential health damage from exposure to radionuclides depends on a number of factors, and it can damage the functions of healthy tissue and organs. Okay, radiation exposure can produce effects from ranging from skin redness, hair loss, and mainly for the radiation burns and towards the acute radiation syndrome. Prolonged exposure to the radiation can lead to cells being damaged, in turn lead to cancer. The last stage will be the cancer, and signs of cancerous cell might not show up until years or even decades after exposure. So dia punya exposure dia memang akan nampak lama lah kalau dia dah memang last stage tu cancer, memang bukan dalam masa yang terdekat, memang ambil masa yang lama. Okay, technetium is my choice of radioactive agent, symbolized as 99mTc. Technetium-99 is a technetium atom and one of the radioactive isotopes of technetium. It is used in tens of millions of medical diagnostic procedures annually, making it the most commonly used medical radioisotope in the world. It is also used as a radioactive tracer and can be detected in the body by medical equipment such as gamma cameras. Okay, the half-life of the technetium is 6 hours. It allows for scanning procedures which collect data rapidly but keep total patient radiation exposure low. Disebabkan dia punya half-life tu 6 hours, so data tu kita dapat kumpulkan dalam masa yang singkat, dan radiation kepada patient tu pun kita boleh kurangkan. Okay, as a personal protective equipment to handle the radioactive agent, the first one, laboratory coat as a gowning, protecting wrist. Dia punya wrist part ni kena macam getah lah. Okay, so dia kena cover kita punya wrist part ni supaya bila kita pakai glove tu, dia takkan radioactive agent tu takkan kena pada kita punya skin. Okay, gloves single pair ataupun double pair should be a nitrile or latex. Safety glasses or goggles, closed-toed shoes. Okay, and then for the staff, they are required to wear whole body thermal luminescent dosimeter and TLD ring dosimeter that will quantitate the amount of radiation to which a person has been exposed. Okay, for extra clothing, let's say there is a contamination happen, a staff should keep an extra set of clothing and shoes in the lab. Okay, so mereka boleh tukarkan mereka punya baju lah kalau ada contamination yang berlaku. Okay, for the handling procedure of radioactive material, technetium. Okay, radioisotope safety procedure. Kita pergi kepada work area, open bench. All aseptic procedures must follow when handling the parenteral radiopharmaceutical preparation or their components. Mesti kena ikut dia punya setiap satu aseptic procedure dia lah. So A to Z mesti kena ikut. Okay, and it should be away from heavy traffic and doorways. Reduce the severity of spreading contaminations in the event of a spill. Reduce interruptions of a delegate and hazardous operations. Okay, if it's enclosures, if the radioactive material presents an airborne hazard potential from dust or vapor, partial containment is offered by chemical fume hoods. Okay, so for the preparation equipment, we should assemble all items necessary for the procedure so that delays can be avoided. Sebab salah satu measurement yang kita boleh ambil time frame kita expose kepada radiation tu kita boleh kurangkan kan. So kita sepatutnya dah assemble items tu, apa-apa barang yang kita nak gunakan dekat satu tempat. So kita takkan ambil masa yang lama untuk kita cari bahan-bahan tersebut sebab dah radioactive agent tu dah ada kat situ kan. Okay, for the second one, absorbent paper for cover the work surface with protective and absorbent bench paper. Okay, dekat yang saya tunjuk kat sini, absorbent paper. Dia adalah untuk trap droplets. Let's say kalau ada spill, few drops ke yang maybe kita tak nampak ke. So kalau dia terkeluarkan daripada syringe, daripada needle tu, so dia akan terjatuh dekat atas absorbent paper ni. Okay. For the emergency supplies, attempt to foresee what problems might occur, including spills, and store the appropriate materials close to the work area. Some examples would be extra gloves, absorbing covering, wipes, plastic bags, forceps, decontamination solution. Okay, yang saya tunjukkan ni adalah fume hood yang kita ambil daripada salah satu hot lab, radiation lab. Fume hood tu sepatutnya chemical resistant material. Okay, dia lead protective, should be lead protective. Okay, fume hood dia punya function protecting users and environment from exposure to radioactive. It's an enclosed workspace. Okay, macam yang kita nampak ni dia ada. There is a glass shield over here. It protect the personnel. Hazardous gases or vapors generated inside the hood are captured before they enter breathing zone. So dia memang ada macam filter. There is a filter there. They will filter the hazardous gases and vapors. Okay, minimize exposure to airborne contaminants. Okay, itu adalah fume hood. Okay, there is two types of generator untuk technetium lah. Kita akan gunakan ni. Radionuclide generator provide local supply of short-lived radioactive substance from the decay of longer-lived parent nuclide. Okay, example dia technetium generator ni seperti yang kawan pernah bagi tahu dalam slide yang sebelumnya, dia ada parent and daughter. Okay, generator dia provide radiation shielding. Dia memang ada lead shield. Okay, for transportation and to minimize extraction work. So dia akan kurangkan kita punya exposure kepada radiation. Okay, this one is a L block shield. We call it as a L block shield. Memang kita simpan dalam fume hood tu. Okay, it's for receiving and preparing unit dose of high energy radionuclides. Okay, it is used to it's a drawing station. It is easy access. So there is a wall there. It will protect the personnel, and the glass shield for protect our eyes from the radiations. Okay, then this is a syringe shield. It reduces risk of exposure. It provides effective protection of the ends of technetiums during preparation. Ini adalah lid. So syringe tu kita akan masukkan dekat dalam lid ni, and there is a kita boleh nampak through glass. Dia ada one part tu ada glass, kita boleh nampak measuring kat situ. Okay, this is the work process, cara mereka handling, the manual handling of the hazardous. So dekat L block shield ni, mereka akan letakkan tangan sebeginilah. So dekat dia punya L shield tu. Okay, then next is shielded syringe carrier box. It's to dispense the syringe to the ward, transported shielded syringe to ward lah mainly. Lepas kita dah buat kita dah syringe out technetium tu, we put together with the syringe shield and we transport to the MA or the staff, the respective ward. They'll come to collect the carrier box. Okay, this one is the example for the radio iodine. I just take the picture as the example. It's a lead pot. Okay, okay. This is the radiation shielding materials. Okay, transfer of the rays. Okay, apa yang menunjukkan sebab kita cakap sebab lead memang dia protect daripada radiation kan. So ini adalah contoh dia shielding material dia. Yang mana kalau paper dia still can go through, the gamma ray still can go through sebab technetium ni gamma ray kan. So lead is the best shielding material. Okay, so exposure to radioactive materials is reduced if movement of the material is minimized and if the storage site of the material is shielded, and also if the area of use has limited and controlled access, and last one is if radioactive waste is appropriately handled. Okay, for the medical surveillance with periodic health reviews on the workers, it should be carried out at least once in 3 years or more, frequently as indicated by the workers' exposure condition and state of health. It's because maybe disebabkan oleh sebab kita cakap kalau setakat radiation burns, skin irritation kita boleh nampak on the spot. Kalau yang macam cancer tu kita memang ambil masa, maybe bertahun untuk kita tahu apa efek kepada badan kita. So at least once in 3 years tu kita kena buatlah medical surveillance tu. Okay, for the clean up procedure, cover radioactive waste bins at all times and provide shielding for waste bins. Okay, ini untuk waste bins untuk yang radioaktif punya. All items involved in the experiment must be either discarded, stored properly or surveyed and cleaned. Okay, reusable contaminated glassware must be rinsed at least twice into a liquid radioactive waste before cleaning. Okay, so dekat sini saya ada tunjuk, it's a shield radioactive waste bins. Okay, the material, the inside material is a lead. Okay, and the inner and outer finishing materials is stainless steel. Disalut lah, macam disalut dengan stainless steel. But still, dia punya lead thickness tu memang tebal. Sebab kita buang waste yang daripada radioactive. Okay, so ini adalah radioactive spill kit. It's a decontamination kit for radioactive material spills. It's for emergency use only. So these are the items, these are the content of the box. There's a disposable gloves, housekeeping gloves, disposable lab coats, disposable head covers, disposable shoe covers, absorbent with plastic backing, mess up meat. There will be a masking tape so we can mark the contaminated area, plastic trash bag with twist ties, tape, caution radioactive material. There will be a marking pen, press trunk text, caution radioactive material, contamination wipe sample supplies, emergency procedure instruction. There should be an instruction for the person to handle the spillage. Okay, clipboard and radioactive spill report forms, and there will be a pencil. Okay, for the emergency plan, is any unplanned happening that could affect radiation safety. There will be some instructions. For example, remove yourself from immediate danger but do not leave the vicinity. We should mark the spill boundary with tape or other appropriate means. Keep all persons out of the accident area until helps arrive and do not remove anything from the accident area. Persons directly contaminated by a wet spill, they should remove their contaminated clothes. That's why tadi just now I mentioned that they should keep extra clothing so they can change their clothing if it's contaminated, and the contaminated one we should place it in a plastic bag, and the body should be washed with mild soap and tepid water. Okay, that's all for my activity 1, and now I just continue with my activity 2. It's a poster. Okay, I choose radioisotope lab, and my one is a physical hazard that it can cause harm with contact. The first one I choose radiation. The problem is exposure time to radiation. The hazard is cancer and genetic disease if it's a long exposure time. Okay, mitigation measure is use proper PPE when handling radioactive agent, and most important, all the items we handle should have a proper shielding. Okay, for the temperature, the problem is too hot because some of the lab, their centralized aircon or the ventilation is not good. So the problem is too hot the temperature. Hazard is heat stroke. Mitigation measure, the normal temperature range is 19 to 21 plus minus 2. Okay, the floor problem is slippery. It's because of the spillage. The hazard is fall down and injury. Mitigation measure is prevent liquid spill. And the workstation extended standing, and I put hazard as a measure. Mitigation measure rotating with staff, and there should be a micro brakes. Okay, that's all for my activity 2, and now I continue with my activity 3. Okay, for the health risk assessment, my category is chemical drug, STS. Okay, I choose Decon 90 as my agent for the chemical drug. Okay, Decon 90, surface acting cleaning, active cleaning agent and or radioactive decontaminant for laboratory, medical and industrial applications. Milky white. It's a non-viscous liquid and having faint odor. Okay, the purpose is for cleaning or decontaminating glassware, ceramics, rubbers, most plastics, stainless steels and ferrous metals. Okay, for the STS of Decon 90, okay, the identification of the substance of preparation Decon 90 and was this STS was updated on 1st June 2018. The purpose of the usage of the Decon 90 is for cleaning and decontaminating agent. Hazard identification, the pictogram is warning. Okay, hazard H 290 may be corrosive to metal as a category 1. Hazard 315 cause skin irritation as a category 2. H319 cause serious eye irritation category 2. Okay, for the composition and ingredients, it's a mixture of anionic and non-ionic surface active agents. It's a stabilizing agents, alkalis, non-phosphate detergent builders, and sequestering agents in an aqueous base. And it contains also potassium hydroxide, and potassium hydroxide itself has its own acid, may be corrosive to metals, harmful if swallowed, and cause severe skin burns and eye damage. Okay, for the first aid measure, in case if contact with eyes, rinse with water, plenty of clean water, and should be a flowing water, and then seek immediate medical attention. Okay, if in case contact with skin, same also, rinse with plenty of water and seek medical attention if there is persistent irritation. If let's say if ingested, drink copious amounts of fresh water and seek immediate medical attention, and do not promote vomiting. Okay, for the firefighting measures, use extinguishers suitable to the cause of the fire. Okay, for the accidental release measure, avoid contact with eyes and skin, dilute with large amount of water, absorb large spills with sands or any suitable medium, dispose of in accordance with local authority guidelines. Small spillage may be flushed away with plenty of water to drain or sewer. Okay, handling and storage. Avoid contact with skin and eyes. Should use glass, ceramic, plastic, not polycarbonate, or stainless steel vessels for working solutions because it's corrosive to metal. Store the concentrate at ambient temperature out of direct sunlight, sealed in the container in which it is supplied and away from strong acid and aluminium. If stored correctly, Decon 90 has shelf life of 5 years. Okay, for the exposure, We should wear safety goggles and nitrile or PVC gloves when we handling the Decon 90. Clothes should be protected with alkali resistant apron is to prevent contact to the personnel. Okay. Okay, for the physical and chemical properties, the melting point is shown here, boiling point, solubility completely soluble in water, and the pH value is more than 13. Okay, stability and reactivity, thermal is not known. Hazardous thermal is not known. Hazardous reaction may react violently with strong acid and may produce hydrogen in contact with aluminium. Further information for the metals will tend to corrode non-ferrous, notably aluminium and zinc. Okay, for the toxicology information, toxicity is low, but high alkalinity is likely to be harmful. It will cause irritation to the eyes and skin. Okay, breathing spray mist may cause irritation. If it's ingested, will cause irritation to the gastrointestinal tract. Okay, for the ecological information, Decon 90 is biodegradable. High alkalinity may affect aquatic organism if released into water course untreated. Okay, disposal consideration. Disposed in accordance with regional or national regulations should follow the regulations. Okay, for the transport information, is followed by the STS, as shipping name, as commercial name. The others is unknown. Okay, for the regulatory information, classification, labeling, packaging. Classification as a irritant, that's the symbol for the irritant. There's a risk phrase, irritating to eyes, irritating to skin, and safety phrase, avoid contact with skin and avoid contact with eyes. In case contact with eyes means with plenty of water, seek medical advice. The signal word is warning, pictogram as shown before. A chemical safety assessment for this mixture has not been carried out. Okay, for the other information, there's a precautionary statements as mentioned as P. Keep out of reach of children. As usual, avoid contact with eye, skin, clothing, wear protective glove, proper PPE, wash with plenty of soap if on skin, in eyes, rinse cautiously with water for several minutes, and if there is a contact lens, they should remove. Okay, so meaning of hazard and risk. Okay, this is the hierarchy form for Decon 90. Okay, hazard identification. First one, preparing or diluting Decon 90, and the hazard I put exposure to the Decon 90. Effect, irritation to eye and skin. Okay, for the handling spillage of Decon 90, if there is a spillage, the hazard is spillage in the preparation area, and effect is same, irritation eye to skin. For the disposal of expired Decon 90, same also, exposure to Decon 90, irritation eye and skin. Okay, for the risk assessment, for the preparing, existing risk control as mentioned before, the proper PPE such as safety goggles, PVC gloves, alkali resistant apron, and stainless steel vessel to handle the Decon 90. Likelihood I give 4, severity and I give 3, and the risk is 12. Handling spillage of Decon 90, same, PPE, proper PPE, goggle, PVC glove, alkali resistant apron, and must follow the spillage guideline, how to handle the spillage. Likelihood I give 2, severity I give 3. Okay, disposal of expired Decon 90, PPE, safety goggle, PVC gloves, and alkali resistant apron. I give likelihood 2, severity 2. The risk is 4. Okay. For the risk control, for the preparing of diluting Decon 90, control measure or risk control that we can take. Okay, redesign new work method, monitor work process, the existing work process which we must monitor, and wear correct PPE. Maybe in term of changing of the better mask or something. Okay, for the handling spillage of Decon 90, monitor handling, how they handle the spillage. Is it following the correct method to handle the spill or something? Okay, then follow existing risk control and update to the latest guidelines. Okay, and disposal of expired Decon 90. Okay, must wear the correct PPE. Although it's expired one, we should wear a correct PPE. For example, better to wear double gloving. Okay, and then follow existing regulations and update to the latest regulations. Okay, that's all my presentation for today.
Alright, thank you, Ruba. Right, without any argument, kita go to our first
Thank you.
panel. It's Arfan Azad for comment.
Okay, thanks, test 1, 2, 3. You can hear me, Mr. Ruba pula. Miss Ruba, can?
Yeah.
Okay, I got two
Yes, can
questions. A
hear
very
you.
quick question one, because it's already evening. A lot of us want to go take some rest and having some chocolate. All right. So the first question is about your poster. So I believe your poster is a generic poster that is not focusing on a specific hazard or specific issues. You are focusing on the physical hazard, right? Supposingly, you
Okay, yeah.
only focus on one hazard. It's much more better for you to understand that hazard and synthesis its component. For example, if you're talking about noise, then focus on noise. How the noise is generated, what is the dangerousness of the noise, how the noise can be measured, what is the legal requirement for the noise exposure in community and in workplace, you name it. Understand or not?
Okay.
I prefer that one lah rather than you just proceed with everything that you have over here. Okay, but I find out that you have tried your best in producing a SDS synthesis with the information of the um, common use product among pharmacies. This is very good. I really love your product just now. You are sharing about the cleaning material, which is we call it as a Decon 19. I think this kind of thinking is very good because indirectly you are also sharing some information to your friend. Okay, because this Decon 19 is not only a cleaning product but it's also disinfectant, and then it is not also only for a normal chemical but also can decon the radioactive waste. I mean radioactive debris. It's not really waste. It's just for the
Yeah.
cleaning and disinfecting purposes. So I think it's very good presentation with regard to that. I would like to give the credit to you. However, you can improve in terms of whatever that I already discussed also before with our friend, which is the exposure, frequency, magnitude. Who are going to use this one? I believe the cleaning and disinfectant using this Decon 90 need to have some sort of dummy. Siapa yang sebenarnya nak guna Decon 90 ni? Farmasi kan? Farmasi yang akan gunakan untuk buat decon,
Mm-hmm.
cleankan dekat dia punya
Yeah.
BSC and so on, betul tak?
Yeah. Betul.
Yes. Therefore, you might also follow your friend. Whatever that I said, follow your friend means that this is the adjustment that you need to do. You need to complete the chemical health risk assessment process. As the example lah, for example, the hazard rating, the exposure rating consists of frequency and duration, and then based on the frequency and duration, you akan measure the magnitude, and then based on this magnitude and frequency or duration, then you can establish the exposure rating. So exposure rating with the hazard rating can come out something to do with what we call as the HR, hazard rating. And this hazard rating probably can give the rating of the user for this Decon 90. Mungkin Decon 90 in your clinic is not similar with the Decon 90 punya risk dekat kawan kamu punya klinik because of there is a different type of exposure. Similar hazard tetapi different exposure. That is a very good idea to improve the quality of your presentation lah. Other than that, I think I believe Puan Masdila will adapt a little bit of that so that it is benefited to you. So go back to my friend. Thank you.
Alright,
Tuan,
thank you, Cik Azad.
faham Tuan Ruhan? Kalau tak faham, it's okay because you
Yeah,
can
yeah.
view back this video. Yeah, correct. Okay. Thank
Yeah,
you.
yeah. Can. Thank you.
Alright, thank you, Cik Azad, for the fruitful comment. I hope Puan Ruba will take a note for the future improvement. So from me, nothing much. Okay. I think congratulations for the nice slide and nice attempt regarding the what just Cik Aizat said just now. Maybe you also actually can maintain for the poster. But if you can make amendment like Cik Aizat said, I think you are the one lah yang buat benda yang lain sikit daripada kawan-kawan. You boleh try for that amendment. Okay, Puan Rubah, that's all for me. Puan Rubah faham ke? You're mute.
Okay.
Okay, faham.
Oh, okay, alright. So maksudnya kalau you nak buat what do you have done for your poster is okay, just nice. But mungkin kebanyakan para presenter semua sama lebih kurang macam you. So you buat a little bit different lah daripada kawan-kawan yang you just mentioned for only one hazardous yang ada dekat kawasan tersebut.
Okay. Oh, this is your poster that I already heard before. I think yeah, I agree with Puan Masdila. Yeah, you can maintain and then just update little bit lah. It's very good actually. Yes, I agree with you because it's a new thing to learn. Radio isotope. It's look like a radio television but it's different.
Okay. Any additional from Cik Aizat? Okay, right.
Oh, so good. So we have Puan Azina over there. Yeah.
Hi, welcome Puan Azina.
Yeah, hi, sorry. Arabic class. Hi, Rubah. Is it
Puan
Rubashini?
Azina,
Hi, Puan.
Hi, sorry, Puan Masdila, apa dia?
Yes, it's me.
Puan Azina mengikuti ke session kita before this regarding rubah di slide?
No, just entered.
Oh, okay, alright, never mind.
Okay, please proceed. Thank you.
Okay, no problem. So Rubah, any additional to add on?
So far no.
Okay, alright. Kalau begitu, kita end up dulu for this session and then kita will continue after this. But Rubah, please stay tuned. And guys, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.